Yeah, my name is Dr. Rüdiger Krech, and I'm the Director for Environmental Health and Climate Change, One Health and Migration, and I'm acting in this position at the moment at the World Health Organization. If I had to choose only one word to describe my hopes for the conference, I would say resilience. Why? Well, public health and global health is under attack at the moment. So many crises, man-made, all of them are really challenging what we have achieved in global health. So therefore, we need to be resilient. We need to see how we can operationalize what we have learned so far, all the experiences we've made in global health. Now it's the time to really implement them. And that's why I think resilience is the word. What would change look like? Change would be that we all come together at the World Conference and in a very positive spirit, describing the alternatives that we have to counteract what we currently see. What is it we currently see is, of course, politicization and, of course, misinformation and disinformation all along. We have an alternative to propose, and that is a world where health is central to any policy making, where we're looking at the boundaries of our planet and we implement solutions of well-being societies. And what I would hope as change is that we actually are no longer just combating what comes from the side of mistrust and misinformation, but we're actually proposing in a very positive spirit this alternative to policymakers, to civil society, and also to, of course, economic partners in the field. And that would be the big change. Well, what are the big changes that I'm observing is, of course, the turmoil in which we find ourselves in global health at the moment. Just think of 5 or 10 years ago. 5 years ago, of course, we had COVID. We were in the midst of a crisis where global health was central to policy making overall and to the way societies were organized. 10 years ago, we were of the opinion that actually we can make a difference and that we've overcome the Cold War and many disruptions that we had seen. Today, we are finding ourselves in a complete turmoil. And it's therefore important that we stay on course, that we look at what works and what doesn't in global health, that we come up with the alternatives where we know what works and what needs to be done. And we also, and that's the good news, we know how to do it. And that's the fantastic thing now that we can offer this to the world. And so that is the big change that I've seen, the urgent need for us to not fall into this turmoil situation, to just respond to all the crises, but show the way forward in a positive manner. So the many examples that we have in coming together with the different public health associations and also partner organizations, and to see also if we pulled our roles and responsibilities well together, the networks that we entertain, the connections that we have, this can drive a different policy and help to shift away from the turmoil in which we currently are. So I have seen many of those projects where we actually successfully pulled together and really made a difference, whether it's in tobacco control, in alcohol control, whether it's in well-being economies or in the settings approach, or for that matter, also our work on the determinants of health and equity issues. So we have shown the how and the what, and I think we need to just continue on that path. When we were in COVID times, we have understood that bugs don't know borders. But at the same time, we understand that health is not only national. You cannot have health in one country only. Health by itself and its very nature is population-based and it's global. And that is, I think, what we need to portray much more. So that there is no way how in today's world, where news travel within minutes around the world, where actually we have come much closer together as a global community, where the health and well-being and the mental well-being of people completely depends on this interconnectedness of our world, that also global health responses need to be global in scope. So also our work of global health doesn't know borders. And I think that understanding needs to portray even stronger in South Africa, that we belong together, that we're one global health family, and that we are working with many sectors in order to make the world a healthier place.